Assalamu alaikum. Welcome to Tuesdays with Dr. T. This is Dr. Tasnova from Autism Success Academy. So today I'm going to be talking about achieving speech without speech therapy for your severe nonverbal autism kid. So if that topic is interesting to you, then stick until the end because I am offering some really cool opportunities free to talk about more about how I can help your child and whatnot. Okay, so if you are watching this on YouTube, please consider subscribing and sharing this because not just thousands, millions of autism parents every single day are praying to see a light at the end of the tunnel they are in. You might be a parent, mother or father of an autism kid who is severe, nonverbal, who doesn't know how to communicate, who might be having several other issues, and this is the video for you. Okay. Without further ado, let's jump right into it. The first thing that you need to understand is speech cannot really be developed without working on the brain. Let me repeat it again. Speech cannot really be developed without working on the brain. So if you are sending your child for speech therapies and several other things, that is, you think that it's going to help your child, or you are being prescribed by the doctors and everybody in the autism area as well, that doesn't work. I haven't seen speech therapies working for kids, maybe 5% of the kids, okay? The rest of the 95% kids are actually struggling with their speech because the speech therapy is just teaching the child to learn and memorize words based on a system that is like dangling a carrot in front of a rabbit and asking the rabbit to mimic words and things like that, okay? That's the simplest term. If you are a speech therapist listening to this, please don't come at me. Try to understand from the perspective of actually what you are doing and is it really helping the autism child or not? Because here's the thing. If the child is 3-year, 4-year, 5-year old, that's the crucial time for the child to develop speech. If the child is getting older, it will be extremely harder to recover speech as a milestone, okay? So, like I was saying, the first thing is important is to work on the brain development because without the brain development, speech is not gonna come. Every human babies, whether they're neurodiverse or neurotypical, gets their speech from the activation of the speech centers inside the brain, okay? Every human being has speech centers, learning centers, sleep centers, and all of those centers in the brain. So if you don't work on brain development, brain support, and, brain revival, then you are essentially missing out on the opportunities for the development of your child. The second thing that you need to do for your child is change the diet. Yes, I am the diet lady who keeps on saying about diet. That is important, not everything, because I work on other things as well. I teach other pillars as well, not just diet, but second most important thing for your child's speech development without speech therapy is to work on the diet. So the type of diet that you need to follow is best grain-free, natural. If you can avail organic, good. If you cannot, it's still okay. Okay. I recovered my son's speech without any organic food, just by following the diet, detox, lifestyle, need-based parenting and mindset pillars that I teach to my students, okay? And also to the community. So diet is important. Change the diet to something that is going to help the brain rather than create brain fog. For more information on that, watch the, video I'm linking right up or in the description as well. That will help you to understand what sort of diet you should, feed your child. The third thing that you need to do is work on detoxification. Make sure your child is sweating, pooping, peeing very regularly. Make sure that he is not constipated. Make sure there is large volumes of soft, stool coming out, and make sure that the stool does not contain undigested product. Because if the child is having constipation and the stool is not formed properly or has undigested product, these are massive pointers that tells us that your child has a tremendous amount of gut imbalance, okay? The fourth thing that you need to do for your child's brain development and speech development without speech therapy is to make sure that you become the therapist for your child. So it's not like you will have to force your child to speak every single day, every single moment. No. What you're going to do essentially is creating an environment where your child is attentive. So if your child is hyperactive and not sitting at a place or not having eye focus, I will link another video up and also in the description for you to check out and learn how to overcome that as well. And of course, that is also connected with the 5 pillars and working on the gut. Okay? So when your child is not hyperactive, when your child is sitting calmly and listening to what's going on around, he will learn or she will learn how to speak, what words to use, which words to communicate with, and everything in between. Why? Because that's how human babies study, learn, develop speech. Your child, even if he is severely autistic, is not from Mars or Venus or Jupiter. They are human babies. They are not alien. So if a neurotypical brain develops speech, your neurodiverse kids, the brain will also develop the speech if you give the brain the right amount of support. Okay? The last thing that you need to do to make sure that you're recovering speech for your child is to stay calm. Is to have faith, but not keep on, fighting for the speech, not like banging on the head of yourself and, on the wall, like, why isn't my son speaking? Why isn't my daughter speaking? Speech comes a little late. But if you are giving the 5 pillars the 5 things that I have taught you, and if you're working on the 5 pillars of your child's brain development, then your child will 100% inshallah develop speech. Okay? Muhammad developed speech with 8 months on the protocol. Most of our students' kids, if they're in the age of 3 to 5, they develop their speech within 6 months to 8 months. And if we have older kids, it takes about 1 year to 1.5 years. Okay? So stick around, learn some more. You don't have to send your kids to therapies that are not working. If it's working for you, cool, do it. If it's not working for you, which you are among the 95% of autism parents, and you are seeing that improvement, there is no point going on with something that's not working for your child, right? So work on the things that really changes the game and stick to it. And of course, don't forget to love the video, share it with your friends, share it with anybody who has a kid on the spectrum, and let everybody know that they can recover speech without speech therapies. Until further notice, I'm going. Bye.